have shivers. Thank you so much, Reverend. Our first speaker is the co-founder and CEO of Cyclic, a Silicon Valley digital services agency. She is a 2-time Emmy Award winner and sits on the board of directors at the Transgender Law Center. We are so grateful to have her with us today. Please help me welcome Evelyn Rios.
Thank you. My name is Evelyn Rios. I'm currently working in Fayetteville, and my fiance Bob is back there taking pictures throughout in Fayetteville. Thank you for having me. And I wanted to talk about what reproductive justice looks like for all of us, but particularly for some of the most vulnerable among us, especially in places like Arkansas. The right to make choices about your own body, especially reproductive choices, unites all of us. And all of us need the economic, social, and political power to make healthy decisions about our bodies, our sexuality, and reproduction. Reproductive justice means equal access to health care, the right to have children, the right to not have children, the right to raise children in a safe and healthy environment, and the right to plan families through safe legal access to contraception and abortion. It also includes the right to express our sexual orientation and our gender identity. But severe discrimination prevents many people, including transgender and gender non-conforming people, from having reproductive justice. Many transgender people struggle just to get basic human needs met, needs like living free from violence or having a stable income. At least 26% of transgender and gender non-conforming people report being physically assaulted at some time in their lives. Last year, at least 23 trans people were murdered in the United States, and most of those victims were trans women of color. Trans people are 6 times more likely to experience police violence. Transgender and gender non-conforming young people are particularly at risk for sexual abuse and for engaging in sex just to survive. Fear of violence and discrimination can keep transgender people from coming out to anyone about their transgender status, including healthcare providers. Unemployment for trans and gender non-conforming workers is twice the rate of the population as a whole. And again, the numbers are worse when you look specifically at trans people of color. As a result, trans individuals often lack the economic power they need for reproductive justice. Transgender people also face massive discrimination in the healthcare system in the United States. This ranges from health insurance restrictions to outright refusal to provide care. Some trans people are afraid to talk to doctors and nurses because of fear of humiliation. A study out of Wayne State University in Detroit found that 32% of trans men reported being verbally harassed in a doctor's office. 28% were denied equal treatment, and 1% were physically assaulted in a doctor's office. Another study found that half of trans men do not receive annual pelvic exams because they can't find a medical provider that they can trust. Up to 27% of transgender people also reported being turned away by healthcare providers who refused to provide care for them. And again, the numbers were even higher when you look specifically at people of color. 48% of transgender people postpone getting medical care when they're sick or injured out of fear of discrimination or disrespect. I've been among them. I've had apprehension about finding a new doctor in a new place. I've had trouble finding a gynecologist who is not only accepting but aware of transgender issues. Transgender people need access to breast cancer screenings, cervical cancer screenings, prostate cancer screenings, and STI screenings. Many transgender teens, including those at risk for unintended pregnancy, are reluctant to go to family planning clinics. We need to get away, by the way, from abstinence-only education, which harms all of us. According to the CDC, transgender people experience HIV infection at 4 times the national level. Transgender people of color, again, are especially at risk. Healthcare providers often lack basic knowledge about trans people and their health needs. In a nationwide survey, 50% of transgender people reported having to teach a healthcare provider about providing appropriate care for themselves. Barriers to healthcare coverage often mean trans people must either pay out of pocket or go without medically necessary care. For example, health insurance companies have denied coverage for transgender women who need prostate exams or transgender men who need mammograms. Many health plans also exclude coverage for medically necessary transition-related care. Transgender patients who need reproductive health care often fear that they'll be treated in ways that are disrespectful or judgmental because of their gender identity or sexual orientation, or because their bodies are different. Too often those fears are justified. Many providers assume that transgender patients don't need services like pelvic exams or contraception, or that treating transgender patients is too complex for their practice. The most important step the medical community needs to take toward ending discrimination against transgender people is educating providers. Medical schools only spend an average of 5 hours on LGBT issues, and some schools never discuss the topic at all. When I was putting this speech together, I asked some folks over Facebook in the Arkansas trans community to share some of their experiences, and here's some of what they shared. One trans man told me that, quote, finding insurance that we can afford that covers all our health needs is almost impossible. Another trans man told me that he was afraid of what would happen if he went to the police after being sexually assaulted. Too often, trans people are left out of the discussion on sexual assault. Trans men who are sexually assaulted also need access to rape kits, STD screenings, and abortion services. But too often this process results in humiliation, being the butt of jokes, and officials who use the wrong name and pronouns, making the experience even more traumatic, piling on top of the sexual assault. Reproductive justice means remembering that trans people need to go to clinics for birth control and hormone replacement therapy too. It means using language that makes trans people feel included in healthcare settings. It means training doctors and nurses to use correct pronouns. It means understanding that trans men have abortions too. And by the way, I do stand with Planned Parenthood. It means remembering that trans women use cryobanks so we can one day have families too. It means allowing gay couples and transgender parents to adopt. It means understanding that trans men and trans women need access to comprehensive reproductive health care. It means health insurance plans that don't exclude transition-related care. Now, there are some strides being made in this area right here in Arkansas. Last year, the Arkansas Transgender Equality Coalition, the University of Arkansas Medical Sciences College of Public Health, and the Patient Centered Outcome Research Institute launched a project called Transform Health Arkansas. This project is right now wrapping up groundbreaking research on the health needs of transgender and gender nonconforming people right here in our state. In Washington, the Department of Health and Human Services has issued new proposed regulations that would make it illegal to fill health insurance policies to categorically deny coverage related to gender transition. And we hope those are going to get adopted. The same ideology that tries to coerce women into having children, that in the past has sterilized people of color under eugenics programs, has also created a web of regulations regarding what trans people can and cannot do with their bodies. Many nations, and some states here in the U.S., still require trans people to be sterilized through sex reassignment surgery before we can change our gender markers on our IDs. This turns parenthood into a privilege rather than a right, and puts the government in charge of deciding whether a person has undergone invasive medical procedures. Having a proper ID affects everything from marriage to child custody to adoption. Reproductive justice means putting those decisions in the hands of the individual. It means fighting for everyone's right to choose. This is why transgender rights are reproductive rights. Thank you.